Hello everyone. On May 18th, news broke that made me question our country's healthcare system. In a government hospital in Patna, a specially abled patient was bitten on the foot by rodents. Let me say that again. A patient who is already vulnerable was attacked by rats, that too in a hospital that is a place meant to heal. Friends, this is real India. This is India 2025 and we aim to become Viksit Bharat by 2047. This forces us to ask, what do we really mean when we say healthcare in a country that is currently the fifth largest economy in the world? Is it just a word we just rant and we show off and we use it in speeches? Or is it something real? Or is it something that is meant to serve people? In today's video, let us pull back the curtain on India's healthcare system because when politicians cut ribbons and news show flashy headlines about AI health tech, medical tourism, and new hospital launches, there is a very different story going on in the wards, waiting rooms, and the villages of India. In today's video, I will be talking about the problems India faces today in our healthcare system and what I think needs to change. The number one problem we face are infrastructural gaps. According to the IPHS data, only 20% of health facilities meet the minimum quality benchmarks. And when it comes to hospital beds, we only have 1.3 beds for 1,000 people, according to a report by Knight Frank and Berkadia. And this is far below the World Health Organization recommendation of 3 beds for 1,000 people. So we are currently short by 2.4 million beds. Moreover, we also need better quality government hospitals. In Bihar, a 2022 audit by the Comptroller and Auditor General (CAG) of India found that many primary health centers didn't even have functioning toilets. Let me ask you, friends, will a poor patient admitted in a rural hospital get the same facilities a rich patient who is admitted in a top class hospital? The second problem we face is death due to medical negligence. Friends, in November 2023, a toddler was admitted in a private hospital in Pune and during treatment, he was kept in a baby warmer that caused serious burns and injuries in its leg and he deceased because of these injuries. This is not just one news. In November 2024, the major Jhansi hospital fire case. In 2024, a government hospital in Jhansi caught fire in which 10 newborns lost their lives. You know why? Because 49 newborns were kept in the neonatal intensive care unit, but the capacity was only 18. And this had caused a short circuit which eventually led to fire. One more news. In March 2025, a pregnant woman who was admitted in a hospital in Uttar Pradesh died because she was operated on without conducting any medical tests and without the consent of her family. Friends, these are just three examples. Every day, patients die due to negligence by the hospital staff. And this happens in both government as well as private hospitals. And no steps have been taken to prevent this. You know what Portugal did when a pregnant Indian woman died in 2022 due to negligence? You won't believe. The health minister resigned. And in India, when this happens every day, maybe 2 lakh compensation will be given and a week investigation will be carried out. That's it. But well, let's not talk about this because this is a topic on which I can make a separate video altogether. The third problem we face is human resource crisis. Data from the National Health Portal shows that in India, there is only one government employed allopathic doctor for every 10,000 patients and one state-run hospital for every 90,000 people. This distribution is highly uneven. Rural and poor areas face major shortages of hospital staff, and this ratio varies from place to place, and we need to fix this because healthcare is a privilege and everybody requires it. According to the Rural Health Statistic Report 2021 to 22, there is a severe shortage of specialist doctors at community health centers with nearly 80% of the required specialists unavailable. The fourth problem we face is affordability. Do you know that in 2011 to 2012, health expenses pushed 55 million Indians into poverty, and also 67% of healthcare spending on Indians is spent on medicine alone. You know why? Because many people often buy branded drugs, and branded drugs can cost almost 10 times more than generic ones, even when the ingredients that is used in both of them are exactly the same. Public hospitals are definitely cheaper, but all of us know the standards and the quality of these public and government hospitals. The private sector, which dominates the Indian healthcare system, is highly unregulated, and this leads to variations in quality as well as cost of service. If India wants a healthcare system that is fair, accessible, and effective, here is what we need. So, I have come up with some possible solutions, and even you can drop what you think should be done in the comment box below. First change we need to do is boost public spending on health, not only to meet targets but also improve the quality of facilities and services that are provided to the patients. India spent only 2.95% of its GDP on health in 2019. And this is even less than China that spent 5.35%, and this is even less than Nepal, who spent 4.45% according to the World Bank. In India, there is only one doctor for 834 people, and every day when we open the newspaper, when you open the regional newspaper of your area, you will always see some kind of new bridge or road being built. But this same money that is used to build a new road or a new bridge can be used to open a proper government hospital in that same area. We need to spend more money on MRI machines. Do you know JJ Hospital in Mumbai currently has only two MRI machines, one for general patients and one for emergencies. The second solution is that we need to fill staffing gaps by training and fairly compensating healthcare workers and making them work in areas which are often underserved. We need to open more and more government hospitals and medical colleges, and at the same time we need to increase the seats. Hence, we see so many doctors studying in India and going abroad and working there. But when we open new colleges and when we increase the amount of medical seats, most of these doctors who are actually moving out will get to work in India, and this will rotate the wheels of a better healthcare system and hence a better future. We need to open more and more regular clinics within every 2 to 3 kilometers. There should be a regular medical clinic that is run by the government, where we will also get medicines, and patients can go there for minor problems, for example a normal fever or a normal bruise. This will not only make healthcare more accessible, but it will also generate many jobs. Friends, there are many nurses in India who go to Middle Eastern countries. Why? Because there is a larger demand for healthcare there. Opening such clinics will also supply jobs to these nurses and will rotate wheels of our employment as well. The fourth solution is we need to expand health insurance and ensure that schemes like Ayushman Bharat are widely understood and accessible. We need to make health insurance more cheaper so that poor people can afford it as well. While the government can definitely charge some money to conduct major operations, but I feel that medicines in at least the government hospitals should be free of cost. The fifth and the most important solution is that the government should boost manufacturing of generic drugs, and more people should be made aware about it. So, firstly, what is the difference between generic and branded medicines? Well, the thing is that there is no difference at all. Both generic and branded medicines use the same ingredients. However, branded drugs often have a patent of their manufacturing company, and because of this, their prices go higher. So, generic drugs are way, way more affordable, and branded drugs are expensive, but there is no difference between both of them. However, many people often do not know about this and often choose to buy branded drugs. When more and more people will start opting for generic drugs, the manufacturers of branded medicines will eventually have to lower down their prices, and this will eventually lead to less differences. India's healthcare system is a paradox. While we are opening new hospitals in some areas and there are world class hospitals in some areas, we are struggling to survive in others. Whether it is a high quality hospital in an urban city to a local government clinic in a rural area, I feel that everybody should have the same facilities because good health should not be a privilege. What are your opinions about the same? I would love to hear them in the comment box. Thank you.